We think about 80 to 90% of all of us as adults have had an episode of back pain or neck pain, within our lifetime.
Dr. Michael Steinmetz is director of the Cleveland Clinic Center for Spine Health.
It's rare that we go right into surgery for patients' problems. Only if it's, losing neurological function or something, that would be an indication to rush right in. We typically try to have patients get back into exercise. We'll often use physical therapy with stretching and strengthening. Certain medications, even over-the-counter non-steroidal medications like ibuprofen or Aleve or Tylenol work. That often, just that combination in its own fixes the problem in most everybody.
Steinmetz says spine surgery has come a long way.
So it's one of those operations, for the most part, for arthritic degenerative disease, that we can have a significant positive impact on patients' quality of life. Get somebody who wasn't walking any long distance because of their back issues and now getting back to walking. And when we look at robotics, what's happened in spine surgery, over the last 10 to 20 years is really a focus on less invasive surgery. So still being able to do what we need to do, accomplish the goals of surgery, but just do it in a smaller way through a smaller corridor, say in the back of the neck. And robotics have really helped us do that, right? It's helped us gain access to the spine and especially put in spinal hardware, say screws and these sort of things into the spine in a much more accurate way. And that's really how robotics, I think, is changing spine surgery and will continue to change spine surgery moving forward. It's not like the old saying, the robots are coming. There's no autonomous robot doing surgery on anybody's spine. Think of it almost like as an extension of the surgeon to some extent. And what robotics has allowed spine surgery to do is to almost simulate the surgery first. So for example, I can plan my operation out on your spine in advance using your anatomy. So taking a CAT scan at the time of surgery or even beforehand. So taking your bony anatomy in three-dimensional view, and on a computer, I can plan out exactly what I want my surgery to look like if I'm putting screws and exactly where they'll go. These are new and exciting times in spine surgery. I think we talk about how a robot helps us today, like putting in hardware, helping us work through smaller corridors in the spine. It's exciting to understand, I think, what they may do for us in the future, say for like bringing in augmented reality, where you could use augmented reality glasses and look at a patient who's maybe on the operating table and see through their body, see the spine directly, and then interact with a robot to do your operation. So there's exciting things like that working towards the future, where we're going to be able to do things safer, more efficient, and through smaller corridors. I think this is just the beginning. We're in the early phases of robotics, and I'm excited to see how this evolves over the next 5 to 10 years or so.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.